So I'm Ajay. So I'm going to be showing you our project, which is TrackCovid19.org, which is a crowdsourced community-based illness tracker. So let me quickly introduce the team. So I am Ajay Hegde. I'm a neurosurgeon by profession. I've been supported by Abhilash and Vinayak, who have listened to all my tantrums in developing this project. And I've been advised by Professor Masti, who's a professor of public health and is actively involved in the Bangalore contact tracing and quarantine team. So first, let me just quickly run you as to why we need a community-based tracker. So all of you must be very familiar with this chart by now. And you must be also be familiar with these graphics which show flatten the curve. So from a public health point of view, these are not of much value. They look beautiful. They tell us, okay, there are so many cases in this area, and that's about it. So this made me think and go back to my medical textbooks, where in 1854, that is 166 years back, this man, John Snow, he was a physician in London. He mapped cholera in London and found that there was one water tap which was contaminating everybody in the locality. And then he mapped the deaths to the level of each house and how many deaths had occurred to this in that house. So coming back to this, in 1854, if we had so much of data, today in 2020, we have data maximum up to a district level, I would say, nothing more. So that is why we sat ahead and designed this project, which is primarily to track asymptomatic carriers and symptomatic carriers, as it is impossible to test everyone in the community. And the policy of lockdown, track, trace, and community surveillance. So we intend to play a part in the community surveillance part. So our solution is a community-based crowdsourced illness tracker, which crowdsources symptoms like cough, fever, or shortness of breath. And it has the granularity of going down to a zip code or a pin code. So there's a lot of evidence here I can share with whoever is interested. I will not bug you with that. So what we did is we took a world map and then we layered all this data. We took the symptomatic people, healthy people, and then we took some confirmed positive and any other data set. And the source of this data was the healthy and symptomatic people came from crowdsourced data. The other two data sets are primarily by going through media articles and government databases to see if we can find specific locations of these people who are infected. So we've not been able to get much information on the last two layers because we don't have ideal databases to the level of a zip code. And as I mentioned again, all this is done to the level of a zip code. And this is a brief outlook of the technology. So this is our product. This is the product we've had for a week now, collected data from around Bangalore. So you see the green circles are the healthy people. The red ones are the symptomatic people. These are not people who have COVID-19, but just people who are symptomatic with cough. And I mean, it doesn't look as good as the map John Snow did in 1854, but it's probably better than the others we thought. And let me come to the impact. The impact is primarily a public health impact. So I've demonstrated two representative samples. So if you see the green circle is big, then it means you're in a healthy community. So the public health individual of that area can say, okay, let's give this community some time, let's isolate it, or probably you could release them from a lockdown quicker. But the same community, if it has a big red circle, then that's really a problem. So then all the resources have to be directed to that community to test, test, and test. So from a public health perspective, it gives you this information. It helps you identify hotspots, direct surveillance to the right areas, phased opening of communities from a lockdown, and it allows you to test the right cohort. And for the consumer,
Ajay, 1 minute to go.
it tells you what's happening in the locality. And I'm going to quickly tell you why this will work at this point of time. So between stage 2 and 3, I would want to highlight to you guys that community surveillance plays a very important role. And the feasibility, there's high engagement in such technologies during pandemics, increased social media network usage, and a community that wants to help. So I leave you to just scan this QR code or visit our website, TrackCovid, which is live. And you guys can have a look at it yourself, where I also run you through it very quickly. So I'll ask you what I need right now. So Dr. Jacob and Mr. Patil, I need your support for national implementation, promotion, and providing postal codes of confirmed positive individuals. So we're not asking for any patient identifiable information. We're just asking for postal codes, not again cities. And the tech community, Mr. Chinnaswamy, we want you to help us promote and incentivize usage with GPay and cloud credit from Google to scale operations. And Mr. Mittal and Mr. Raghava, we need some money to scale operations to employ a full-time support if we have to track the whole of India. And probably this could develop into a national infectious disease tracker. And we need some Facebook credits. And coming to the strengths of we're working on further features like cloud. Yeah. So I'm just going to quickly run you through the platform. Yeah, this is the platform we have. So this is yes or no, and then it gives you live data. You go down to the level, gives you granularity up to a zip code. You can see any zip code you want, and I'll let you play. And these are the live stats as to how many people have been registered on our website. And you guys can go and use this and track yourself and get to know what's happening in your community. Yeah, hello.
Thanks, Ajay. I have I'll take two questions.
Yeah, sure.
Tracy is asking, how is community data updated? Are users supposed to update their symptoms regularly?
So that's the thing. So we don't have a login screen yet, but we have the facility for that. And we are in the process of developing a login, which is just a 4-digit code which comes up when you submit the data along with your zip code. And when you enter that, you go to your own data and you can edit it. So that's in progress. We don't have it yet. We don't want to use emails, phone numbers, nothing. We don't want anything to track back to the user. We just want the zip code and a 4-digit alphanumeric code, and you'll be there to edit your data.
Okay, and Biju Jacob is asking, can you integrate it with IDSP, which is National Disease Surveillance Program?
I mean, if definitely it should be. The outlook of this project is beyond the coronavirus epidemic. I mean, this has to be implemented on a national scale, considering India is quite susceptible to infectious diseases. I mean, we need technology like this to track infectious diseases down.